we're delighted as a foundation trust, a health service organisation, to have the opportunity to work with Adults Supporting Adults, with Care UK and with Lace Housing to develop something different for some of our patients. And we're talking about, particularly I think for our organisation, and Julie I think would agree with me on this, we know that part of that increasing number of patients coming through, there are significant numbers of people with dementia, with Alzheimer's, who we know are living longer and will need services. There are lots of people who we have to plan care for, and our framework for doing that is to make sure that the service that those people receive is the same type of service that you would expect every person in this room if it was a member of your family or a friend of yours. So thank you for the opportunity, Trixie, to follow on from you and describe this project. Now, as an organisation, we're a health organisation. We could continue in Lincolnshire doing really well, providing the services that we do forever and ever if it was up to us. But what we know is that we have to work differently, and with our partners, and more of it, to make sure that we meet the challenge that Nick described earlier, which is more demand, more patients in need of services, and a reducing amount of money that we've got to spend on those services. So we need to be innovative, creative, and do things very differently to maybe the way we've done them in the past. So what does this mean, Jane? What are we actually talking about? What we know as a health service, so I'm talking now about the acute hospital, our organisation, and the community services organisation, is that people often get their care in an accident and emergency department. They have an emergency, they maybe have a fall or another physical health problem, and they go to the accident and emergency department. So our project is aimed at ensuring the person who goes to the accident and emergency department has their emergency care needs met, but once they are well enough to go home, we do that as soon as possible. For a person with dementia in an A&E department with a tannoy going, surrounded by an environment they're not familiar with, that's not a good place to continue to spend your time once you're well enough not to be there anymore. So we will improve outcomes for people if we can get them back to being at home where they want to be. And a lot of the patients we see say that is exactly where they want to be. They want to be independent in their own home. The partnership we've created with Trixie and colleagues is to wrap services around those people so we can get those people home. Thank you, Stephen. And those services include basic things: transport to get somebody home, sitting with that person, getting their heating on at home if that's what they need, getting maybe some shopping in. And then hopefully as we grow this, it could well be that as voluntary and statutory sector organisations, we're getting to a point where you can expand your services by providing additional services into that person's home, keeping them well and safe in their local community and at home. And we've got a track record of doing this as an organisation. We've invested something like £500,000 this year in community infrastructure, so things like activities for people, laundry services, gardening services, things that keep people safe and well in their local communities. We want to do more and more and more of that investment. We don't provide those services, but we want to invest in the providers who do, because we recognise we won't survive without that wider infrastructure and support in local communities.